People have asked me, what causes the brain fog that comes at menopause? Well, there's actually several things that contribute to this. Number one is lower estrogen levels in the brain. Lower estrogen levels in the brain actually affect the way that our neurons or our nerve cells synapse as those of us who were born with uteruses. So it's really important to help normalize that. Now, if you've had a history of cancers that preclude you from having hormones, there is actually some other things that we can do. Certain herbal selective estrogen receptor modulators, which are basically act as estrogen in the brain, but act as anti-estrogens in the breast and the uterus, and have good safety studies are available. Number two is actually the issues that occur in our adrenal glands, which predate menopause by a long time. So a lot of people actually notice this before their estrogen levels fall. And that issue is that there's a hormone called DHEA, dihydroepiandrosterone. And that hormone is made in the adrenals. There's these little glands that sit on top of our kidneys. They make cortisol, which is our fight or flight hormone, but they also make DHEA, which is a hormone that shuts off cortisol. Way before we actually go through menopause, our DHEA levels fall. That actually starts in our late 30s. And DHEA then cannot shut off cortisol. So when we have an increase in cortisol, for instance, when we're under stress, our ability to shut it off actually is not as good as it used to be. And so we stay in this heightened state of basically hypervigilance and dealing with stress because we can't shut off this hormone. Now, this also has a lot to do with why people gain weight at menopause. So watch me for more on this.